we don't feel like it's our job to pick people's coverage for them. It's our job to educate people into a great understanding of their coverage options so they can make an informed decision.
And then advocate for them.
Yes.
You have a trusted team around you to really help you. Because, when you're looking at Medicare for the first time or as you are in retirement and using it, oftentimes it gets overwhelming for a lot of people. So you need that team around you to support you.
Welcome to the Medicare Made Simple podcast with MediConnect. I'm Lance O'Brien, joined by Sean Horne. How you doing?
I'm doing great. It's been a while since I've been in this chair, though. Thanks for welcoming me back, and happy to be here. And I know that we have a very important subject today.
Well, you've been out on the road a lot lately. I think we've done a little bit of details on this, but maybe just give everybody a quick update on what you're focusing on these days.
Yeah, so I'm the Director of Strategic Partnerships for MediConnect, where our goal is to help strategic partners understand that we narrowly focus in on healthcare planning for clientele outside of MediConnect's purview. So financial planners, estate planners, they do a phenomenal job with their level of planning, but oftentimes the Medicare piece is, alphabet soup to them. They don't quite understand it. So they bring us in to do the healthcare piece. We oftentimes handle that, send them right back to, their division of work. So managing a lot of relationships, opening up a lot of opportunities in the community with just more awareness and how we can help the community at large in advocating for their healthcare needs.
Yeah, and great results so far. A lot of key partnerships that you've been able to build, and really excited to see where this goes moving forward, because again, it's not just the individual consumer that struggles with the complexity of Medicare or where to turn when that happens. There's a lot of businesses, HR, people who provide services similar to ours, like you mentioned, estate planners, financial planners, that really benefit from us being a resource for them. So it's exciting stuff. I'm really looking forward to see how it continues to develop throughout the year.
Yeah, I am as well. I mean, I think we're off to a pretty hot start and look forward to continuing to build to provide that value add to their practice and their community. So again, people could just thrive with their healthcare decisions.
Yeah, so I think you already mentioned it. Very important topic today. So what you got for me?
So we're seeing more and more in the news, headlines are really dominated by seniors are losing benefits. Mm-hmm. And we're going to stay away from the political angle there because it's very messy anytime you talk politics, but it's a concern, a valid concern for a lot of people. And how do I plan around what's happening in the legislation when this stuff is already confusing enough to try to understand?
Yeah, I think unfortunately, and then like I said, we'll move on from this. It doesn't matter who's in charge or in office. I unfortunately feel like they use this as a leverage piece and even sometimes as a fear piece, right? Like, we're cutting this, we're cutting that. And if I was a senior, right, if I was 65 or older, that's really important to me, right? So for me, when I'm hearing all this noise from all of these different angles, it's going to make me wonder, like, are my benefits safe? Can I have confidence in my healthcare? Because healthcare is one of the greatest costs that a senior will face as they move into a fixed income. So we really want to address that today and how we help an individual feel confident about their coverage and let them, as we educate them, let them select the level that is right for their situation.
And to that point, to expand on that just a little bit further, when you get the readout from the government side on what could potentially be at stake, of course, there's reconciliation in the bills. People got to vote on it.
Right.
So a lot of preliminary information gets out there. But when this information does get out there, then it becomes, who do I trust with it?
Yeah.
So you've talked in previous episodes that we've done together that there's misinformation and disinformation relative to Medicare, just like everything else in our society now. Well, now that we're focusing in on how these legislative changes might be impactful to the Medicare beneficiary, I think it's really time to hone in on, look, we can't really address what happens on a government level, but we can help you on an individual level to protect yourself against what may come down the pike.
Absolutely. Absolutely. So I think a good place to start today is that red, white, and blue card,
Yes.
right? Because for most people that are retiring, they really know, hey, that's my Medicare card. Now, they might not exactly know what it is or what it covers. So why don't you start there? And before you do, I know I want to kind of create a house for them today.
Sure.
Right? Which I think that visual will really be helpful for them as we move through the podcast. But I often refer to as the red, white, and blue card as the foundation of their health care and retirement. So let's talk about it.
Yeah, it makes sense. And I think it is a great place to start and a great way to really compare it. So the foundational piece of Medicare being the government side, A and B. A is your hospital coverage, which we always liken that down to and really try to simplify it as inpatient.
Yep.
So that's largely going to cover 4 components. It's going to be your inpatient hospital, home health care, skilled nursing, hospice.
Yep.
Those 4 areas, Medicare Part A, which most people do not pay a monthly premium for. When you use it, however, there's usually some exorbitant costs to come along with it. But again, inpatient is the category. Then we move on to the medical side. That's Part B, as in boy. Part B is medical, and that is outpatient.
Yeah, very easy.
For most people to understand,
Yes.
right? But you're looking at doctor's visits, physical therapy, scans, outpatient surgery, durable medical equipment, Part B medicine, so those medications administered to you by a doctor. Those are all, I think I said physical therapy. Those are all components of Medicare Part B, where, again, you're not admitted into the hospital. This is an outpatient service. You're getting it, and you're leaving that same day. And typically, most people will have a monthly premium for Part B, about $185 for most people in 2025. And then once you pay that premium, there's a deductible attached, a little north of $280 roughly. And then once you hit that deductible, it's an 80-20 rule of Medicare, which is what most people are familiar with.
Right.
With both components, however, it is important to know there's no out-of-pocket maximum. There's no financial shutoff switch.
And that's really the big thing. And that's why we describe this as the foundation, because it does cover your inpatient and your outpatient services, but there's still a lot of out-of-pocket costs that the individual consumer could be required to pay because there is no max out-of-pocket. So again, if I go into the hospital and all I have is a red, white, and blue card, and I'm in there for 150 consecutive days, that's going to run that consumer a little over $60,000. Significant amount of money, right? So I don't know about you, but I don't want to live in or simply on a foundation, right? Because there's no protection,
Right.
Right? Like if I live on a foundation, then I'm exposed to all the elements. And I think it's very, very important for people to understand, because the biggest fear that I have for someone is when I see that they only have the red, white, and blue card. Because if they're very healthy and they're not using it, then they're probably like, this is really great coverage that I'm not paying a whole lot for. But the first time they have to use that, inevitably for something significant, the financial ramifications could be depleting for them.
And to that point, I've never said this on radio. I've never said it in a seminar. I don't often say this out loud, but let's talk about the value proposition that you get with Medicare A and B, only paying, for most people do, $185 a month, because it's 80-20 coverage.
Yeah.
That by itself is actually really good.
Yeah, I mean, that's why it just dumbfounds me when people say Medicare's not good coverage. Medicare actually is good coverage for an affordable price.
It is.
The red, white, and blue card, but there is still massive exposure.
But again, that without limitations on cost, there's no threshold that you can finally hit and you're at $0 at that point. You know, that's the main component of that. And I'll expand on it a little bit further. I have a client who I helped years ago, was getting on a Medicare for the first time due to a heart transplant, and got everything situated with his health care, 2 weeks after which his heart comes in and he has surgery done, right? Well, we looked at all of his bills after that procedure. He was only in the hospital for 7 days, discharged home.
Oh, I'm ready to hear this.
Which is crazy by itself, but the billable amount for the surgery, anesthesia, anti-rejection medicine, everything, little north of $2 million.
Yikes.
So if he didn't have coverage to go behind that, he would have been responsible for at least $400,000 out of pocket.
20%.
I mean, who has that kind of money just laying around in case you need a heart?
Well, I can tell you right now, the national average of people at retirement is about $200,000 in their 401ks and stuff. So he would have been one of the people that fell into medical bankruptcy ultimately.
Which happens more and more in this country. So we got that out of the way. We talked the foundation, which you need to have a beautiful foundation laid for yourself. And I think Medicare A and B does that.
I agree.
But then you have to get extra coverage.
Yeah, you need walls. Let's start there, right? We want to be able to stand up some walls to give some protection from, if you will, the horizontal winds of life, right? So that's where private insurance comes in, and that would be your Medicare supplement or a Medigap.
Correct.
Some people might have heard Plan G, Plan N, Plan F.
Yep.
Or a Medicare Advantage plan. So let's talk about these because they do build on the foundation of Medicare.
Yep.
They give us some walls. What do those walls look like?
Ooh, okay, so
I know that was a loaded question. We could do an hour podcast just on that question.
we could, but I'll try to do my best to simplify, which we often do, right? Medigap, Medicare supplement, we call that prepaying for your coverage.
Yep.
Oftentimes, you're going to have a higher monthly premium, lower out-of-pockets as you use it. These are oftentimes good for, your snowbirds or people with high expected medical costs, largely because it's going to work very well inside of our country without network limitations. And again, it's going to really limit your out-of-pocket costs when you go to use it. So those are really good things relative to how a Medigap plan works. You do have to get a separate drug plan.
Doesn't cover dental, vision, and hearing.
Correct.
There are still other aspects of your health that it doesn't cover as well, which we're going to get into in a minute. But it does a really good job of solidifying the A and B issues.
Really making it so that your foundation is covered well. Mm-hmm. Medicare Advantage does everything I just talked about in reverse.
Yep.
So Medicare Advantage, you are paying for your coverage as you use it. Oftentimes you're going to have a lower monthly premium, a little bit higher out of pockets when you use the plan. Does cover dental, vision, and hearing typically, does cover drug coverage, but oftentimes you're relegated to a network. And oftentimes you do have to get prior authorizations from your doctors and so forth if you want to go see a specialist. So I will say, though, one is not bad, the other is not best. They're just different.
You're stealing my thunder.
Sorry for that.
That's okay, because, to me, every time we talk about this, I feel like I have to do this because I see it all the time. Medicare supplement is the only way to go. Medicare Advantage is bad. Medicare Advantage is the only way to go. And that's not the way that we operate. We don't feel like it's our job to pick people's coverage for them. It's our job to educate people into a great understanding of their coverage options so they can make an informed decision.
And then advocate for them.
Yes.
You have a trusted team around you to really help you. Because, when you're looking at Medicare for the first time or as you are in retirement and using it, oftentimes it gets overwhelming for a lot of people. So you need that team around you to support you.
It's a really good point because I don't do hardly any appointments anymore. I haven't run very many appointments the last 2 or 3 years, really. But I did meet with somebody who had watched us seen our commercial on TV, had called in, wanted to meet with the owner. Mm-hmm. I guess they got the next best thing or whatever,
We'll take it.
They got to sit down with me at Starbucks in the middle of the city. And, as I was walking through it, at the end of it, he asked me in his situation, what would he do? And at that point in time, I did provide, based on his health needs, all of that, what I would recommend he would do in that area. So we do have a fiduciary, big word, big insurance word. We do have a trustworthy responsibility, right?
Yep.
That we're to provide. But at the end of the day, we want the person we sit across the table from or who comes to our office to have such confidence in the education that they've received from us that they can make a great decision on what walls they want to put up, whether it's a Medicare Advantage plan or it's a supplement.
Effectively, we want them to have ownership of the decision.
Yes.
We're just providing a guide rail so that they don't go off road.
Exactly.
So with that, we understand a little bit now how Medicare Advantage works, how Medicare Supplement works, how they differ, why some people go one route versus another. We got the walls forming now, right?
Yep.
Guess it's fair to say now we need a roof.
Correct. So with original Medicare, we've got a foundation, but maximum exposure, right? With a supplement or an advantage plan on top of the original Medicare, we now have walls. We have what I would label medium exposure. And some people might be listening today and they're like, well, I thought all I needed was an advantage plan or a supplement, right? Like that is going to be the only coverage I need. What people don't realize is Medicare only covers what Medicare covers, right? And I know that seems like a really simple circular argument statement, but the supplement only covers what Medicare covers. The advantage plan covers what Medicare covers, but they can add some extra things in. But at the end of the day, it's really, really important to understand that there are some things that Medicare doesn't cover. What are some of those things?
I think the biggest one that we're potentially talking about really comes down to things like experimental treatments. Advanced treatments related to chemotherapy. Again, you're going to get some coverage along the way, but it's not going to be very comprehensive.
Right.
So oftentimes when it comes to Medicare, a lot of time where people find themselves, spending a lot of money when they go to use their coverage comes from the bigger events such as cancer, heart attack, stroke, your long-term hospital stays. A huge one, skilled nursing. Right? I mean, these are things that are very expensive to cover. So unfortunately, the government and the insurance plans don't do a great job of comprehensively managing those costs for each beneficiary.
Yeah, so if somebody comes to us and says, you know what, I was just knock on wood, I was just diagnosed with cancer and they want to put me on a trial drug. Is Medicare going to cover that? Is the private insurance company going to cover that?
Unfortunately not. Some studies may, but they're few and far between, unfortunately.
Yes.
So the downside to that is if you come across something where you're potentially looking at a treatment where it might be advantageous for you, a lot of that is going to come out of pocket.
Yeah.
And to that point, if you don't mind, most people don't work their entire life to build up their 401k, build up their retirement savings account in the hopes of, hey, if I get diagnosed with something, I at least have it covered here. No, this is your money to live with.
Yeah, it's to enjoy what you've worked for. It's not to endure the physical hardships of life.
Exactly.
Yeah. So for us, it's like, okay, we've got the foundation, but it's maximum exposure. We've got the walls. There's still medium exposure. And you mentioned things that are trial in nature. What a lot of people don't realize, like with a cancer diagnosis, 54% of expenses with a cancer diagnosis are non-medical in nature. So
what does that mean?
Loss of work time, loss of wages, travel, all of those types of things. So, I know from my own perspective, if I got a diagnosis like that, I'd want my attention to be on my health and my health primarily. I wouldn't want to be worried about my finances at the same time. Like, I don't want to be like, okay, I've got this going on over here, but now can I pay for this? Because is doing this as long as you have been. If people feel like they can't afford it, what are they going to do?
They're not going to do it.
They're not going to do it. And to me, that's heartbreaking.
Yeah, I mean, we see it time and time again, especially, more so years ago, whenever the donut hole was more of a factor, people would cut their medicine, not pick it up at all. I mean, you're talking about diabetics not picking up their insulin because of how expensive it is. Think about that on even a macro scale relative to even more significant health scenarios where, again, you got this trial medication, could be a chemotherapy. This is what's going to save you, but you don't have the type of resources available to you. I mean, we have seen it time and time again over the years. So I think we're now kind of, circling the bend here relative to we see this all the time.
Yep.
How can we plan for it? Especially here in our community here in Pittsburgh, one of the most active areas when it comes to cancer diagnoses. Yeah. I mean, it's number 2 or number 3 in the country.
Yep.
Here in Allegheny County and surrounding communities. So when you're talking about that kind of number relative to a smaller population scale, this is impacting more and more people each and every day. So we're in a hotbed of opportunity for it. How do we better protect ourselves against an unfortunate situation like this?
Yeah, so we obviously talk to people about this in our education process. We've had people ask us about it, but hey, how do I make sure I have the best coverage that I can afford? So for somebody who gets original Medicare, a Med Sup, they still have some of those trial issues. They worry about the out-of-pocket expenses. There are plans out there that will give lump sum payouts for cancer.
Whoa.
Yeah, so like once you get a cancer diagnosis, you just get paid whatever the face amount of the policy is, right? So that money can go to them, and then they can use it for the medical portion. They can use it for the non-medical portion. And honestly, we've worked with people in the past who actually have received more than both of what those would require, and they get to keep the excess money. But what it does is it gives them peace of mind. Same thing be true with somebody who goes with an Advantage plan, because there are a little bit more out-of-pocket risks with an Advantage plan, right? But you're not paying as much up front, right?
Correct.
So for them, they want the comprehensivest. Maybe they can afford the $150 a month that the Medigap would cost them, plus the prescription plan on top of it, but they can afford the $20 for the Medicare Advantage plan and the $40 for these other types of insurance policies that we're talking about,
yep,
where for $60, they're getting a lot of confidence in their coverage.
I'll use this analogy. I don't know if this works, but I'm going to throw it out there to see if it lands for you. But I've oftentimes, these are called indemnity policies. Yep. And I've oftentimes called it two different things. First, it's like hitting the lottery on the worst day of your life.
Yeah, I love that expression. I actually have never heard you say that, but I do like that because, again, it removes that big fear of the finances.
Yeah, and I mean, you've often talked about this before in-house here at MediConnect, where, it's insurance is risk.
Yep.
It's transference of risk. We, one of the first questions we're asked when we're taking our license way back in the day, right? What is the purpose of insurance? It's transferring of risks. Yep. So to know that, again, you're getting that unfortunate diagnosis, but you're also hitting the lottery on the same day. We never want you to have to come across a diagnosis like that. But if it does happen, knowing that you have a lump sum of money there. Also, the lump sum payment, I call that also living life insurance.
I like that too.
So think about that. Most life insurance, obviously, it pays upon
death.
Which is really weird that they title it that.
It's kind of morbid. It should be death insurance.
Right. It's not really, I don't know how much life there is, but you get my point. But it's living life insurance, because this is a benefit that oftentimes you're going to use while you're still here. And let's take that a step further. With medical advancements that have happened over the last 20 years, for example, it's not happening as much where somebody has a heart attack, they keel over right there, right? Oftentimes, the paramedic comes, they resuscitate you, they get you to the hospital, they're working on you, and people are making full recoveries now.
Yep.
So oftentimes, you're coming out of the hospital, and then you're looking at that big bill.
Yep.
So having that living life insurance is going to pay you a lump sum fee for the rough experience you just have. Oftentimes it's going to cover that big out expense that you might be looking at.
Yeah, and I know, just speaking personally from my perspective, I'd rather pay $20, $30, $40, even $50 a month than look at a $10, $20, $30, or $40,000 bill. It's a lot easier to chew that reality. So like for us, when we're educating people, we really want them to understand their foundation.
Yep.
It's a good foundation, but there's maximum exposure, right? Then we're going to help them with private insurance that they're going to choose based off of the education, which is going to put some walls up for them and limit that risk or make it medium, right? Mm-hmm. Maximum, medium. But then these indemnity plans, they're going to actually put a roof on the house, right? So now it's not just the horizontal that they're protected from, it's the vertical as well, where they're going to feel a sense of peace and security at a price that they really feel comfortable that they can afford. And I think the big thing here is, I do want to go back to your statement on transfer of risk. We really look at this as, we want to educate to the point where they feel super confident, and then they choose how much risk they're willing to accept. Yep. What I wouldn't like, Sean, is if we meet with someone and we don't talk to them about the roof at all, and then that diagnosis happens and they realize there could have been an option that would have given them peace of mind. To me, that's a travesty.
which takes me back to why I'm so passionate about this product. About 10 years ago, I had a client that I worked with. We handled her Medicare needs. And I went back and sat with her to discuss other options, such as we're discussing right now. And met with her. She declined all additional coverage, which was well within her right.
Yeah.
Totally understood. But I got a phone call from that same client about 2 years later from the hospital because she unfortunately had a cancer diagnosis at that point. And she was then asking, hey, is it too late for that coverage? And I hated telling her, unfortunately, now that you've been diagnosed, it is. But knowing that I was able to go over that and she was able to make the determination on her own if this was something for her benefit, I was able to put my head on my pillow at night knowing I did the right thing.
Right.
Which is what we're always guided to do. We're always going to do the right thing. We at least put the information in front of you. You make the educated decision on, do I want to do it?
Yes.
But I think there's more benefit to this type of coverage that we haven't yet alluded to, which is this is a benefit that doesn't pay the provider.
Yeah.
So what does that mean? That
means that, the money comes right to the individual to use at the discretion of how they feel like it's best used. They're indemnifying themselves ultimately, right? So like, again, if they have a benefit for cancer, let's just say it's a $15,000 benefit, right?
Okay.
And the maximum out of pocket on their Medicare Advantage plan is $6,000. Most likely, if they get a cancer diagnosis and need chemo, they're going to hit that $6,000.
Totally.
So they're going to take $6,000 of that $15,000 and pay for their medical bills, but they've still got $9,000, which means if they need to do parking, if they need to do trips, if it's a lot more. I mean, going to the doctor a lot more often because of that. It's a lot more gas. It's a lot of things. It means they literally have control over how the finances are spent, not the insurance company.
This is a pretty unusual story, but it's one that I always talk about relative to this plan. So I had a client, lived in Beaver County, worked with him about 12 years ago, still remember to this day. He had a Medicare supplement plan, really good coverage as we discussed. Again, so it was an advantage, it's just different. He was really happy with his coverage. He had very little out of pockets. However, I still talked to him about it because upon our initial discussion, he let me know that there was some issues related to heart health in his family. So did my due diligence, at least put the program in front of him and let him make the decision. Well, he ended up moving forward, which at that point in time kind of shocked me, but I was like, sure. You have the information, make the decision. So lo and behold, about 10 months after he took the program, he ended up having a heart attack and recovered nicely, very quick, inpatient situation. They had the surgery, did an angioplasty, all good. Well, he got paid this lump sum. He didn't really need it for his health care, though.
Right.
But his township, at that same time he had this heart attack, maybe this is what spurred it, they were putting in new gas lines. And his out-of-pocket cost for this service was about $5,000. He took that indemnity plan and actually paid for that. I don't recommend that being the use and why you take it, but nobody didn't have to go into his other retirement plan. And again, this is the type of plan you get not knowing. Hopefully you'll ever need to use it, but if you do, it's just a nice cushion to have there. It's a nice roof to have for yourself. And just one more point. For those people who do have Medicare Advantage plans, these are very popular and powerful. For the reason, what I always compare it to, it's making your Medicare Advantage plan as Medicare supplement-like as you can. Agreed. At a fraction of the cost.
Yep. 100% agree.
So what do I mean when I break it down for folks like that?
Yeah, so what that means is there are a little bit more, as you referenced, again, the average supplement's going to run you around $150, give or take your zip code and your age when you first get onto Medicare, right? If you go with an Advantage plan, you're going to be looking more like somewhere between $10 and $30, most likely, right? So you've got $120 a month difference there, right? Now the supplement covers most of the A and B out-of-pocket costs, right? Doesn't cover the Part B deductible. Don't want to get too granular there. But like on an Advantage plan, if you got cancer and needed chemo, the chemo you would have to pay 20% for that, just like you do on original Medicare.
Correct.
Right? So that's where, but you can get a cancer plan for say your max out of pocket is $8,300, which is the largest maximum allowed, you can get that for about $20 a month. So if I take and I get my Advantage plan for $20 and then I get my cancer plan for $20, now I'm paying $40. I've got dental, vision, and hearing that I don't have on the other side. You're getting a sup-like coverage for a fraction of the cost.
And for a lot of people that we're meeting with as of late especially, they're seeing the value in moving forward with that because they want to complete the house.
Yes.
And there's a lot of power and a lot of value relative to other areas of your planning, knowing that you're not going to have to dip into your savings in the case of an unfortunate diagnosis.
Yeah, so if I can get educated at the front end of my Medicare journey, know what all my options are, not just original Medicare, not just a Medicare Advantage plan and a supplement, but how I can really indemnify myself against the storms of life, if you will, right? Because they're going to come. People don't magically Benjamin Button, right? They don't get healthier as life goes on. They usually get a little sicker with each year that goes, right? So they're really having all the knowledge up front to make the decision that they want, choosing what coverage option works best for them. But then to me, let's go back to where we started as we wrap up today. It's really about the confidence. Again, I'll say, I don't have a foolproof crystal ball. I can't say beyond a shadow of a doubt there's not going to be tweaks to Medicare, but I think Medicare is very safe. It is a good foundation. Right. But as we've talked about, I need those walls. I need those roof. Private insurance, indemnity brings it all together.
I'm actually going to throw one more thing in, and this does pertain to the government a little bit. Nobody likes paying taxes, right?
I hate paying taxes.
Everybody does. Well, these indemnity plans are non-taxable.
I like that too.
So, again, more value to the consumer knowing that it's a policy that you get the benefit from. It pays you directly. There's no taxation on it. And it's something that you can use as you need to for those, unexpected events and costs that you unfortunately may be relegated to because of an unfortunate diagnosis. Again, I keep going back to that. Just the fact that we're set up in a healthcare system where you work your entire life to get to this point.
Yeah.
Put in your 40, 50 years of hard elbow grease work to finally enjoy. And then something can happen to put you right into a jackpot situation where, unfortunately, it's going to cost you a lot of your savings. It's just, here's the best way to protect yourself.
And there's a lot of options. It's not just cancer or heart attack or stroke, or although those policies are out there. There's what they call HIP plans, hospital indemnity plans. There's short-term home health care. I know me, I'd rather recover at home than in a hospital.
For sure.
And if I can get paid for recovering at home, especially when home health care is generally zero on all the plans, there are plans out there that if you take prescription drugs, you can get a buyback on those prescription drugs, even if your premium is zero. Yeah, we could go in the woods, and it's crazy the options that are available, but it can actually help pay your premium for you if up to a certain amount every year. So a lot of great options. So we want to thank you for taking the time today to listen to the podcast. We want to encourage you to connect with MediConnect. We have a great team here of advisors, executives that want to educate you. If you're not yet on Medicare, help us get you onto Medicare the right way. If you're already on Medicare and you're like, what are these things that they're talking about? I've never heard about this. I think that this could be helpful to me. They should give us a call. How can people connect with us?
2 different ways that we would most highly recommend. You can call during normal business hours, which effectively run 8 to 6 most days, 888-818-6334. Or you could go to our website, MediConnectInsurance.com. And really cool feature, as soon as you get there, there'll be a chat feature pop up. If you just want to throw your questions at us, live people are answering those questions as well. So you can stay anonymous and get your answers until you feel comfortable with the solutions provided to you. But we want to be reachable and accessible every different way that we can to make sure that people were comprehensively covered.
Absolutely. Sean, great to have you back in the seat again. Good luck out there on your travels, connecting with people. I'm Lance O'Brien, Sean Horne. We want to help you make Medicare simple. Thanks for listening today.